Our next speaker is our star student from the early days of the ISCG. He's the star student of Dr. Miami. He seems to be the star student of whatever he's studying. So when he's going to tell you about bioidentical hormone therapy, is coming from a guy who really knows how to incorporate things and really flesh out a practice with them. Dr. Lowney, it is always a pleasure, and I'm so happy to see you back.
All right, well, thank you, Dr. Pelosi. He's much too kind. He's always saying nice things about me. He and his dad, and we'll talk about this a little later in my second lecture, have been such a huge part of my success as a cosmetic surgeon. But before I start the lecture, just a quick show of hands. Anybody out here in the crowd that is presently on bioidentical hormones? So looks like maybe 40%. Anybody prescribing bioidentical hormones presently? About the same. Excellent. So anyway, just before I get started too, I just wanted to thank not only the Pelosi's, but also Dr. Neil Rosier. Does anybody know who Dr. Neil Rosier is? Does anybody take his course? Yeah, he is the doctor who basically taught me just about everything I know. So anyway, a little bit about my background. Board certified OBGYN, been in private practice for about 30 years. I became board certified in cosmetic surgery about 15 years ago. We'll talk a little bit about that this afternoon. Took Neil Rosier's courses about 15 years ago, opened up a bioidentical hormone optimization practice. So anyway, basic truisms in life. You are what you eat, and hopefully everybody's eating mostly organic plant-based diets. You are what you do, so hopefully everybody's exercising at least 30 to 40 minutes of aerobic exercise a day. You are what your hormone levels are, and then you are what you inherited, your gene pool. We don't have much control over number 4, but 1 through 3, we certainly do have a lot of control over. So warning, when I give this lecture, I tell people what you're about to hear is life-changing. I consider bioidentical hormone optimization preventative medicine as well as feel-good medicine, and that's how I actually got my nickname, the real Dr. Feelgood. Okay, so life-changing. So why should you optimize your hormones? Bottom line is because you are never as healthy as the day you turn 21. After 21, it's basically all downhill. Your ovaries start to shut down, testes start to shut down, thyroid shut down, adrenals, etc. And what happens? You get age-related disabilities. You get increased weakness, impaired mobility, poor balance, poor endurance, which can lead to falls, fractures, impairment of daily activity, and loss of independence. So traditionally, this aging process was considered unavoidable. A lot of old school doctors would say, oh, age gracefully, this is just nature taking its course, eat more vegetables, go to the gym, stop smoking, take your lipid medication, take your antihypertensives, I'll see you in a year. But in reality, we don't have to, live that way. There are hormone optimization is responsible for changing people's lives in a better way. So anyway, there are new routine medical intervention programs offering long-term replacement therapy with 1 or more hormones. I'll show you, I'm going to talk about the hormones that I optimize in a minute, but when you do this, you get less deterioration, less illness, a better quality of life. This, like I said, this is feel and function better, live longer, live better medicine. Okay, so quick biology 101, what are hormones? Molecules that are secreted in the endocrine glands, specifically we're talking about thyroid, adrenal, testes, and ovaries. They exert biochemical effects on target cells like the brain, the heart, blood vessels, bone, muscles, fat, breast, uterus, vagina, penis. Basically, there are receptors on every cell in your body. They turn on cellular machinery, therefore they cause increased metabolism, increased protein synthesis, increased cellular repair, and increase in cell replication. The bottom line, in order to stay healthy, you need to keep your hormones optimized. So is normal the same as optimal? Okay, I have a lot of patients come in and say, hey, Dr. Lowney, my primary care physician checked all my labs. They say it's normal. Well, I'm going to be 60 next year. When I turned 50, 10 years ago, I went to see my primary care doctor, and my testosterone was 375. And he said, oh, you're normal, Mark. Just go out and eat more vegetables and go to the gym. And I wasn't feeling normal, and the reason is because if your testosterone level is 301, you're considered normal. But most men don't feel good, do not have the energy they want, the libido they want until their testosterone levels are between 600 and 1200. So that's why we need to optimize. So what happens when we age? We get, again, decreased cellular protein synthesis, decline in your immune function, which leads basically, we live in a state of immunocompetence versus immunocompromise. If you're immunocompetent, you're going to stay healthy and live longer. If you're immunocompromised, you're going to die young. You increase your body fat, you lose muscle mass, strength, you lose bone mineral density, and you have increased risk for cardiovascular disease and cancer. So these are the sexy 6 hormones that I optimize in women: estradiol, men, testosterone, in women, progesterone, DH. So basically, I optimize all of these in women and all of these except progesterone in men. So what are the signs? Everybody here have some OBGYN background. So what are the signs and symptoms of decreased when your estradiol levels start to dwindle? Obviously, you have hot flashes, you have trouble sleeping, you get depressed, you're constantly fatigued. Your skin starts to sag, you get thinning hair skin, you start to get osteoporosis, you're anxious, your mood swings, you have no libido, your vagina starts to dry, you have pain with sex. You don't want to have sex anyway because you have no libido. You start to get wrinkles on your skin, you're going to get your Botox, your fillers, which is not a bad thing. But when you optimize some of these estradiol, you can reverse all these symptoms, but more importantly, you could help prevent these women from heart attack and stroke. Most women don't start to have heart attacks and strokes until after the age of 60 because they have estradiol levels protecting their coronaries and their carotids up until about age 50 or so. Because, again, we know that estradiol can help lower your LDL, which is the bad cholesterol, and raise your HDL, which is the good cholesterol. So, bottom line, estradiol protects from cardiovascular disease, stroke, osteoporosis, dementia, and sexual dysfunction. Not a bad medication. Okay, so let's talk a little bit about testosterone. Again, I said if Ponce de Leon ever discovered the fountain of youth, it would be spewing testosterone because it's really the feel-good hormone. Suzanne Summers put it on the map about 20 years ago. She's written about 5 books. I think this was one of her first books. And everybody probably knows her story. Breast cancer, told she can't go on any hormones. And she said, yeah, the hell with that. I'd rather die. She went and she went around the world, interviewed all the world's experts in hormone replacement therapy, went on hormone replacement therapy, changed her life, and then she empowered women to not be afraid of hormones. Should I feel so much like a woman again? I have plenty of energy, and sex is like when I was in my 20s. This is an actual letter from one of my first patients. She said, "Dear Dr. Lowney, I just want to take this opportunity to thank you for changing my life. I have been happily married for over 25 years, and for the past 5 years, I've had virtually no desire to make love to my husband. After placing me on testosterone pellets, sex is now better than it was when I was in my 20s. Instead of never wanting to have sex, sometimes I need to have sex twice a day. What you have done to me is nothing short of a miracle. Again, thank you for changing my life." I get letters like this at least once a month. It's just, why wouldn't you want to, I never want to retire. You keep getting letters like this. It's amazing. Okay, so what happens when you start to lose your testosterone production? Decreased energy, increased peripheral and visceral fat, the typical beer belly, 55-year-old guy falling asleep at 5 o'clock with a big beer belly, that's visceral fat. Difficulty with attention, focus, difficulty remembering things, decreased muscle mass, weakness, decreased libido, anorgasmia, sexual dysfunction, lack of self-confidence, difficulty making decisions, thinning skin, wrinkles, and actually testosterone is better than estradiol for preventing osteoporosis. So as a general rule of thumb, what I learned from Dr. Rouzier, I dose testosterone in both men and women to effect, meaning I have some women walking around with testosterone levels of 400, 500, and I originally got a little worried about that, and I said, no, we have to lower you. They weren't having any side effects, no acne, no hair loss, no oily skin, no clitoromegaly. I decreased their testosterone down to like 100, 150. They said, no way, I'm going back up. I need to function at 400. Some guys do well at 400, some guys do well at 800, some guys you have to push them up to 1200. Anyway, let's talk a little bit about COVID in the news for the last few years. Low testosterone may increase risk of COVID-19 hospitalization in men. Among men diagnosed with COVID-19, those with low testosterone levels, that didn't make it on the slide. But anyway, bottom line is there was a study done that basically showed that men that came in with low testosterone levels, specifically under 200, did much worse when they were infected with COVID than men that had optimized levels over 400. Okay, so they found that men with low testosterone developed COVID with 2.4 at increased risk for hospitalization. Okay, so the bottom line is that having low T is an independent of all other risk factors that we looked at, age, obesity, other health conditions, but those men that were optimized, their risk was normal. Okay. Thyroid. So thyroid, as everybody knows, is very important for metabolism. If you're hypothyroid, you have decreased energy, difficulty losing weight, your hair starts to thin, your nails get brittle, you get dry skin, you're always cold, you don't think very fast, you're forgetful, you're confused, and you're susceptible to colds and infections, so we optimize thyroid. DHEA, dihydroepiandrosterone, produced by the adrenal gland. It has been called the mother of all hormones. In order to make estradiol, testosterone, progesterone, any hormone in the body, you have to have adequate levels of DHEA. So it's a biomarker of the aging process. 2002 old study, NIH, concluded the only factors in humans that have been shown to prolong lifespan are caloric restriction, aka intermittent fasting, as well as keeping your DHEA levels optimized. All right, New England Journal of Medicine, another old study, showed that low levels of DHEA were associated with increased mortality from cardiovascular disease, cancer. Higher levels were protective against heart disease and cancer. Conclusion, keep your levels optimized. So it protects against insomnia, fatigue, stress, infections, inflammation, heart disease, stroke, cancer, everything. So take 50 milligrams a day forever. All right, progesterone, mostly for women. It balances the effects of estradiol. It protects against endometrial cancer, protects against breast cancer, colon cancer, osteoporosis. Again, it balances your estradiol, so if you're having estrogen excess and you get your PMS symptoms, like it'll help you with headaches, depression, anxiety, bloating, cramps, irritability. It's also cardioprotective. It helps decrease total cholesterol and increase your HDL. It also helps a little bit with libido. You need both estrogen, testosterone, and some progesterone for your libido. And is anybody out here taking progesterone at night? Does it help you sleep? You get a good night's sleep? So what happens when you sleep? You lose weight, yeah. Well, hopefully you're getting REM sleep, and during REM sleep is when you naturally increase your human growth hormone naturally gets produced. So you need to REM sleep to stay healthy. Also very good for treating postpartum depression, and yes, you do need to optimize progesterone if you have a hysterectomy or an endometrial ablation because you still have breasts. You want to protect your breasts. Vitamin D. Okay, so I tell people if you have a choice between eating food, drinking water, or taking vitamin D, take vitamin D. It's not really a vitamin, it's a hormone, as everybody knows. It's probably the number one thing you could do other than, plant-based intermittent fasting and exercise to boost your immune system and therefore protects you from inflammation, which causes cancer and infections. Protects against bone loss, osteoporosis, heart disease, cancer, dementia. Everybody north of Atlanta is deficient, and most people, this is an old slide, I need to update it. Most people probably really need 10,000 units a day to keep your levels optimized. You go to your primary care doctor, your level comes back 40, oh, you're great. Keep on that 400 units a day. I keep my levels 80 to 120, and you really don't get toxic until over 150, and that's even being disputed right now. Okay, high-dose vitamin D may help treat incurable diseases. Again, oral daily dosing of D3 from between 5,000 to 50,000. This Dr. McCullough did a review, and he basically said that we are just underdosing people with the current 400-unit dose that people are recommending, that we really should be using 5,000 to 50,000. Autoimmune diseases occur when the body's immune system starts to break down. Vitamin D regulates immune cells, as we know. Again, we talk about it decreases inflammation, activates the immune cells. Some observational studies are showing that if you keep your levels over 40, you have a decreased chance of getting cancer. All right, and then again, there were studies showing vitamin D supplementation in COVID. Study done at the VA. Vitamin D3 and D2 supplementation reduced the associated risk of COVID-19 infection by 20 to 28%, and COVID-19 infection ending in death within 30 days by 33 to 25%. So if you're worried about another pandemic coming around, keep your D levels optimized. I actually tried to get COVID, as stupid as that sounds, when it was, because I saw these, well, I heard about this study was not out yet. I didn't get the first wave. I got the Omicron variant, and the only reason I knew I had COVID is because I kind of had a stuffy nose. I had no other symptoms. I was actually going to go to work. I tested myself, and I was positive. I said, well, that's not going to be good optics if I go to work with COVID, so I took a week off, but I felt great. So frequently asked questions: are all hormones the same? Aren't hormones harmful? Should be taken for the shortest time necessary to control perimenopausal symptoms, AKA, that's what ACOG is saying right now. Do oral estrogens cause blood clots? Are you ever too old to start hormones? And if you had breast or endometrial cancer, is it still okay to take hormones? So, no, they're not all the same. Bioidentical is not the same as synthetic. Premarin, Provera, Prempro, they should be, I hope there's nobody here listening to this, they should be outlawed. Basically, 2002, so that's 20 years ago, Women's Health Initiative study, 40,000 nurses from New England. They had to stop the study because there was an increased risk of breast cancer and heart disease in women that were on Premarin and Provera, mostly the combination of the two, because Provera is really the culprit. Why are they still selling this stuff? It's like Roundup. You might as well keep on using that too. So the real culprit is Provera, because it's a synthetic progestin. It's very inflammatory, and that's the reason why heart attack, strokes. It's not a progesterone. They call it medroxyprogesterone. It's progestin. All right, so as we said, there's never really been a good peer-reviewed study showing that bioidentical hormones cause anything. Matter of fact, they've been associated with decreased risk of heart attack and stroke, and progesterone decreased risk of breast cancer and colon cancer. Do they cause blood clots? No, they don't. Provera does. However, if you have a history of blood clots, it's probably safer to go on a transdermal, so you're not having the first pass through the liver. Are you ever too old to start BioHRT? Well, are you ever too old to start a whole food plant-based diet? Are you ever too old to start going to the gym? Well, that answers the question. And are you a candidate if you had a history of breast cancer? And I answer that question possibly. As Dr. Rouzier would say, those who took his course, if it were me and mine, yes, I would go on it. If it's a patient, hell no, because if it comes back, you're going to get sued. But what I do in my practice is, if you've never had metastatic disease, you're 5 years NED, you should at least consider going on testosterone. They actually treat breast cancer with testosterone pellets. So that's what I do at my office right now. And I try to get the blessing of the oncologist. I ask the patient, please ask your oncologist. If the oncologist says absolutely not, then I'll say, well, listen to your oncologist, unless you're my wife or my sister. All right, so again, everybody knows what it does. It does everything: reduces your cholesterol, increases your energy, helps with sexual dysfunction, helps prevent some cancers, cardiovascular disease, may increase your longevity. Well, if it's doing all that, why wouldn't it? And where do we go from here? This is the panel I check. Obviously, estradiol, total-free testosterone, progesterone, TSH, free T4, T3, T4, vitamin D, DHEAS is what you check to optimize your DHEA, lipid fasting, lipid profile, hemoglobin A1C, and patients come in after they've had these labs. It takes about 2 weeks for me to get these back. and then I optimize them. So there's all different ways you could optimize. Estradiol comes in pellets, pills, creams, patches, testosterone pellets, creams, and injectables. Progesterone, I use pills. I haven't found a cream that works very well to get good blood levels. Thyroid pills, DHEA pills, vitamin D pills, or injectables with vitamin D2. I'm a control freak. I try to talk all my patients into going on pellets because then I'm in control. If I tell a patient, hey, use this cream once a day, twice a day, take this pill twice a day, they're not going to do it. I put 137.5 of testosterone with 6 milligrams of estradiol in a pellet in your hip roll. It's not going anywhere for the next 3 days. You are going to see results, guaranteed, good or bad. It's coming. All right, well, thank you very much, and I'll be available for questions at the coffee break.